Gather and clean required examination equipment. You will need the following equipment: Snellen chart, Ishihara chart, eye cover, pen torch, ophthalmoscope, white and red-topped pins, tendon hammer, 512 Hz tuning fork, neurotips, cotton wool, and a tongue depressor. Perform hand hygiene. Introduce yourself to the patient and check their identity by confirming their name and date of birth. Explain the examination and seek verbal consent to proceed. Consider if a chaperone is required. The patient should be comfortably seated. Make sure the area to be examined is adequately exposed, whilst also taking care to maintain privacy and dignity. Assess the patient for any distress and ensure they are well enough for you to proceed. Ask if they have any pain, clarifying the location. The examination structure involves general inspection, followed by systematic examination of the cranial nerves. Inspect for muscle wasting, facial asymmetry, ptosis, and lack of expression. Ask about any change to sense of smell. Perform a smell identification test if necessary.
I'd like you to smell that. And what is it?
Coffee.
Ask the patient if they have had any trouble with vision and if they wear glasses or contact lenses. Test visual acuity using a Snellen chart.
I have a chart on the wall over here.
Okay.
If you cover one eye and read from the top down.
It's an OAT VXH OTA UHV TAX HVOA.
And cover your other eye and read from the top of the chart down.
That's OAT VXH OTA UHV TAX HVOA.
And again, that's 6/6.
And color vision using an Ishihara chart.
So if you cover your left eye, what's that number?
It's 12, 8 and 6, 29, 57, 5, 3, 15, 74, 2, 6, 97, 45, 5 and 7, 16 and 73.
Now if you cover your right eye, you do the same again.
12, 8 and 6, 29, 57, 5, 3, 15, 74, 2, 6, 97, 45, 5, 7, 16, 73.
Near vision may be tested using a near vision chart.
Again, if you cover your left eye and read,
He moved forward a few steps.
so that's N5.
Okay.
Cover your right eye and do the same again.
The camp stood where?
And again, that's N5.
Test the visual fields and map the blind spot. Use a white pin, which gives a sharp demarcation of fields and blind spot.
So if you cover your right eye, so this is a white pin, and tell me when you see it.
Okay.
And tell me when you see it coming in.
Yeah.
Tell me when you see it coming
Yeah.
in. Tell me when you see it.
Yeah.
Now look for your blind spot. So you see it there, it'll
Yeah.
vanish in a while.
Yeah, it vanishes there.
And tell me when it comes back.
Back again.
Okay. And we do the same with your right eye. Tell me when you see it.
Yeah.
Tell me when you see it.
Yeah.
Tell me when you see it.
Yeah.
Tell me when you see it.
No.
And the same again. Look at me and tell me when this goes.
I can still see it. Can still see it. And it's gone.
Tell me when it comes back.
It's back.
Okay.
The use of a red pin provides information on color desaturation.
Cover your right eye And tell me when you see this and what color is it?
Okay, it's just a black.
Tell me when it goes red.
Note at the periphery, the patient will perceive the red pin as black.
Still black. Red now.
Tell me when you see it first. What color is it?
It's black just now.
Tell me when it goes red.
Red,
Tell me when you see it.
black, red, black, red.
Okay.
Repeat the examination on the opposite eye.
Tell me when you
Okay.
see it.
Black and red. It's black, red. Black, red. Black, red.
Okay.
The use of a dynamic finger gives a good identification of peripheral fields.
If you cover your right eye, tell me when you see my finger moving.
Yeah,
Tell me when you see my finger moving.
yeah,
Tell me when you see my finger moving.
yeah.
Tell me when you see my finger moving. And cover your left eye. Tell me when you see my finger moving.
Yeah,
Tell me when you see my finger moving. Tell me when you see
Yeah.
it moving. Tell me when you see
Yeah.
it moving.
Perform ophthalmoscopy in a darkened room.
Concentrate on that point on the wall.
Look for the red reflex and examine the optic disc, blood vessels, and retinal background.
Okay, and we'll do the same with your left eye. Okay,
Test pupillary response with a pen torch, checking the direct and consensual light reflex.
I want to shine this torch into your eyes. If you look straight ahead, I'm looking for a direct pupillary response and an indirect pupillary response. A direct and an indirect.
Test accommodation, observing the pupils in distance and near vision.
Now I want you to look at this torch and then I'll bring it near and I want you to look at it again. So look here. Now look here.
Compare both pupils, noting the pupil size and regularity. The third, fourth, and sixth cranial nerves are tested together. Ask about double vision.
So look at this torch. Do you see one torch or two?
one.
Observe resting gaze, looking for ptosis and nystagmus. Test eye movements in all directions, asking the patient to keep their head still and follow an H formation.
And just follow this, keeping your head steady, just moving your eyes.
One. One.
Test pursuit and saccadic eye movements.
Tell me, do you see one or two objects?
Just one. 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 One.
Now in the middle here, I want you to look up and down.
Test light touch sensation in the ophthalmic, maxillary, and mandibular branches.
So this is cotton wool. If you look straight ahead and tell me when it touches you.
Okay. Yeah. Yeah. Yeah.
You feel the same both sides.
Yes. Yeah. Yeah.
Pain, temperature, and vibration sense can be tested if necessary. Test the muscles of mastication. Ask the patient to clench their teeth and palpate the contracted temporalis and masseter muscles.
I would like you to clench your teeth tightly. And open your jaw.
Ask the patient to push their jaw open against pressure to test power. Test the corneal reflex with a wisp of cotton wool at the lateral edge of the cornea.
So I'm going to use cotton wool coming from the side, and I'm going to touch your cornea. Corneal reflex is present on both sides.
Test the jaw jerk reflex with the jaw loosened open. Place your finger between the lower lip and chin and tap your finger with the tendon hammer. Test the facial muscles. Ask the patient to raise their eyebrows and wrinkle their forehead to test frontalis.
I'd like you to wrinkle your forehead.
To open their eyes widely, blink and screw eyes tight shut to test orbicularis oculi.
And don't let me open them.
To puff out cheeks to test buccinators, and to purse lips to test orbicularis oris.
Now blow out your cheeks and put your lips together, and don't let me pull them apart. Okay.
Ask about any change in sense of taste, or test taste using sweet, sour, or bitter solutions on the anterior 2/3 of the tongue. Conduct a whisper hearing test by whispering a number into the ear while occluding the contralateral ear.
I'll give you a number. 23. What number was that?
23. 25.
Perform the Rin test on both ears. Initiate vibration of the tuning fork and then place the vibrating tuning fork onto the patient's mastoid process of the tested ear. Ask the patient to cover the opposite ear with their hand. Ask the patient to report when the sound can no longer be heard. After the patient can no longer hear the tuning fork placed on the mastoid process, move the vibrating tuning fork adjacent to the ear canal with the tines oriented perpendicular to the ear canal, approximately 3 to 4 centimeters from the ear. Ask the patient if they can hear the sound conducted through the air. Note, in clinical practice, most clinicians will place the tuning fork on the mastoid and then in front of the external canal and ask a patient which is louder. Note that the Rin test specifically identifies conductive deafness, which is not testing a cranial nerve, but can help to differentiate conductive versus sensory neural hearing loss when performed with the Weber test. Perform the Weber test. Initiate vibration of the tuning fork and place it centrally on the forehead. Ask the patient if they hear the sound louder in the right ear, left ear, or if there is no difference.
Where do you hear that?
In the middle.
If necessary, perform vestibular tests, including the vestibular ocular reflex. Cranial nerves 9 and 10 are tested together.
Examining your
Ask the patient to cough, swallow, and say ah while viewing soft palate movement, mouth, and gums.
open wide and just say ah.
If necessary, test the gag reflex using a tongue depressor. Test the sternocleidomastoid muscles by turning the head to each side against resistance.
If you push your face against my hand, and the same on this side. Push your head down forward.
Test the trapezius muscles by asking the patient to shrug shoulders against resistance. Inspect the tongue for wasting or fasciculations.
And I want you to open your mouth and stick out your tongue.
Ask the patient to move their tongue from side to side quickly.
And put it back in.
Clean the examination equipment and perform hand hygiene. Thank the patient, then allow them to dress. Explain your findings to the patient and complete appropriate documentation in the clinical record.